Hypoxia means low oxygen, and we usually mean low oxygen in the environment around you when we talk about hypoxia. And there's two key types of hypoxia. There's hypobaric hypoxia, which means low pressure hypoxia, and then there's normal baric hypoxia, which means normal pressure hypoxia. So high altitude is hypobaric hypoxia. When you go to altitude, the amount of atmosphere on top of you, above you, is less, so the pressure is less. So as the pressure decreases, the amount of oxygen in the air that you breathe would go down. So compared to Vancouver, which is at sea level, if someone was at Everest Base Camp, the atmospheric pressure there is about half what it is in Vancouver. So the actual amount of oxygen molecules would be half what they are in Vancouver. The other type of hypoxia is normal baric hypoxia, and that's what you have with hypoxic tents. You hear athletes training in either hypoxic houses or hypoxic tents, and how those work is you don't change the pressure at all, but you actually dilute the amount of oxygen in the air. There's always been a question whether the hypoxic tents and the normal baric hypoxia, whether they're actually equivalent to real outdoor altitude, terrestrial altitude, or to the hypobaric chambers. And that's a question that hasn't been adequately answered. So the goal of the study, where we were comparing normal baric hypoxia and hypobaric hypoxia, was to use a very rigorous design so that the subjects experienced both types of hypoxia, as well as a sham condition. They're actually at sea level pressure and sea level oxygen, and they don't know it. And then a fourth condition where they actually had low pressure, but the same amount of oxygen at sea level. So we looked at a bunch of these different parameters under all the conditions. We had everybody blinded, and we really couldn't find any significant differences. Differences either in the rate of illness, altitude illness, or differences in the amount that people breathed, or the way that their body compensated for the altitude. For people that have to go to altitude, some of them will prepare by training in a hypoxic tent, or using devices similar to a hypoxic tent to prepare them for that. And we previously didn't know whether that was effective training. We didn't know whether the hypoxia that they were using in training was going to affect their body similarly to the true altitude. And the findings of the study show that these surrogates for true altitude seem to be similar enough to create the same kind of response in the body to altitude.